My name's Mary Lynn, and I'm so glad you're here with us today for an important and meaningful conversation. Today's session, Getting a Positive Type 1 Diabetes Screen, Coping with the Fear, Uncertainty, and Hope, is part of our ongoing effort to bring education, resources, and community to those touched by diabetes. At Diabetes Sisters, our mission is to support and empower women living with all types of diabetes through education, peer connection, and shared experiences. Early detection of type 1 diabetes can have a profound impact on outcomes for individuals and for families, and that's exactly what we'll be exploring together this afternoon. We're honored to be joined by a wonderful lineup of experts and community voices. First, I'd like to introduce Dr. Victoria Buhari, board certified in endocrinology, diabetes, and metabolism, as well as lifestyle medicine. She's the founder and CEO of Perry's Wellness and Diabetes Center and a proud board member of Diabetes Sisters. Dr. Buhari is deeply committed to improving healthcare outcomes and advancing population health initiatives. We're also joined by Jude Johnson, a licensed marriage and family therapist with more than 20 years of experience. Jude specializes in trauma, anxiety, depression, and stress using evidence-based techniques, including brain spotting, CBT, IFS, and MBSR. His integrative approach combines neuroscience and compassion to help individuals find clarity, resilience, and emotional balance. We're also grateful to have three incredible women with us today who will share their personal experiences with type 1 diabetes screening. Kelly Schmidt is a functional dietitian and founder of Type 1 Functional Nutrition. Actually, I believe it's T1D Functional Nutrition. Sorry, Kelly. Alejandra Marquez is a Diabetes Sisters Hispanic Initiative leader and diabetes advocate. Chelsea Lugone is a family nurse practitioner and certified diabetes care and education specialist who currently works on the clinical education team at Dexcom. Thank you all for being here and for your willingness to share your stories and insights. A positive screen for type 1 diabetes can bring a flood of emotions: fear, guilt, uncertainty, and the overwhelming question of what now? Today, we'll explore how to process those emotions in a healthy way, understand what a positive screen means and what comes next, and find strength and clarity through knowledge and community support. You'll hear both professional insight and personal stories that remind us that early knowledge is power and you don't have to face it alone. I see some more people who would like to join us. And where is my... So I have a couple of housekeeping things. Before we begin, you're welcome to use the Q&A throughout the first half of the presentation. And then after the main discussion, we will move it into breakout rooms for a live opportunity to speak directly with the speakers, ask questions, and in a smaller, more personal setting. So we're honored to have today's conversation with Dr. Buhari, who will walk us through why early screening for type 1 diabetes is so important and what steps we can follow for if we receive a positive result. Dr. Buhari, thank you for being here. The floor is yours.
Well, thank you for that, and welcome everybody who is joining us today. So we're going to go ahead and get started with the presentation part, and this is going to be short, and then we'll dive in and have the group come together for us to talk about it and answer any questions that you may have. So the first thing here is, what is type 1 diabetes? So type 1 diabetes is a chronic condition, which means it's a long-term condition in which your body doesn't produce enough insulin. And there are particular cells called the beta cells that are found in the pancreas. And these cells get destroyed by an autoimmune process or an attack of cells that are within the body. And this results in a decreased amount of beta cells and therefore a decreased amount of insulin. Now, insulin is important because it's the hormone that causes your body to be able to regulate blood sugar. So when you don't have enough insulin, that means your body can have very, very high blood sugar levels, and that can lead to serious complications such as diabetic ketoacidosis. So why should we screen? The whole point of screening really is to ensure that we can recognize type 1 diabetes at a very early stage. We all know that there's a lot of demands when it comes to living with type 1 diabetes, and that's from constant monitoring, the need to have a team that you trust, a team that's reliable and accessible to you. What happens when you exercise? How much insulin do you take? How much food do you eat? What type of food do you eat? The insulin and cost of insulin, and knowing what type of insulin to use, the short acting, the long acting, and also the emotional struggles that come with type 1 diabetes. So there's a lot of daily demands, and that's something that we all recognize as providers and also people who are living with type 1 diabetes. We do know that developing type 1 diabetes is that if you have a higher family history or more family members who have type 1 diabetes, then you have a higher risk of developing type 1 diabetes. That being said, majority of people who have type 1 diabetes do not have that family history. But if you have both parents with diabetes, you have a 30% risk of developing type 1 diabetes. A father only is up to 8%. If it's mother only with type 1 diabetes, that can be up to 4%. But as I mentioned, majority of people actually do not have a family history of type 1 diabetes. And unfortunately, 40% of people who are diagnosed with type 1 diabetes have that life-threatening condition that I spoke about, which is diabetic ketoacidosis or DKA. What we know now is that type 1 diabetes actually occurs sometimes months to years before the clinical signs of type 1 diabetes show. And what that means is that when people are actually diagnosed currently with type 1 diabetes, or the majority of people, they're in stage 3. And that's what we typically see, right? Where you have the signs, being thirsty a lot, urinating a lot, nausea, vomiting, high blood sugars. That's actually stage 3. But there's stage 1 and there's stage 2 also that exist. Diagnosis of type 1 diabetes occurs when you have the presence of at least two antibodies, and we'll go into more detail as to what those antibodies are. But as long as you have two of those antibodies present, you have a diagnosis of type 1 diabetes. In stage 1 type 1 diabetes, your blood sugars are normal. And also, you don't have any signs or symptoms of diabetes. In stage 2, that's when you have elevations of your blood sugar. It's not as high as stage 3, but a little bit more elevated than normal. And then finally, the typical high blood sugar and symptoms occur in stage 3. So we really want to screen because we want to detect type 1 early. We want to be able to detect type 1 in stage 1 or in stage 2. And the reason why we want to do this is because number one, we can really monitor people who are in those early stages of type 1 diabetes. And monitoring comes with regular blood sugar checks. What we've seen is that those who are monitored early, who are recognized and monitored early, the risk of diabetic ketoacidosis goes down from that 40% all the way down to 5%. So we get to prevent hospitalizations. We get to be prepared, right? So if you are diagnosed early, screened early and diagnosed, you get to have the knowledge and education that to prepare you for that stage 3 type 1 diabetes. And also you get to have the ability to undergo any clinical trial that might be accessible to you. There's also early treatment for stage 2 type 1 diabetes. So screening and detecting type 1 early is very instrumental when it comes to making sure that you have really good long-term outcomes with type 1. So screening involves a blood sugar, a blood check. And this can be through a finger prick, it can be through a venous blood draw in a lab. And we're looking for four antibodies, and these are the four that have been recognized by the American Diabetes Association for screening. It's the zinc transporter 8, the GAD antibody, we have the AL2, as well as the insulin autoantibodies. There are many ways in which you can be screened. You can do it through a research screening program such as Ask or TrialNet. It can be done through the state. Cascade and Pledge are some examples. Your primary care or your health care provider can request a lab called Enable Biosciences, and this gets shipped over to their clinic. And you can do the test in the clinic or you can take it home and do it there. You can also go to a nearby lab, LabCorp, Mayo, or Quest, and get the labs drawn there also. So if you test positive, we first of all, we want to make sure we confirm to make sure that the test remains positive. And if it is, then we'll say whether you're in stage 1, 2, or 3. After that is monitoring. And as I mentioned, the opportunity for you to undergo clinical trials, the opportunity for you to um, start medications as needed. So having a positive test really afterwards involves more intentional monitoring as well as education. A new medication was FDA approved in November of 2022 called Tzfeld. And this medication actually has been shown to really slow down the progress of stage 2 type 1 diabetes going to stage 3. So we're really seeing that there's a delay in people entering stage 3 or that clinical type 1 diabetes by an average of about 2 years. So it's the first medication of its kind that has been shown to delay the onset of the clinical stage of type 1 diabetes. And at this time, I'm going to turn it over to Jude.
Thank you, Dr. Bahari, and Mary, thank you for your introduction. It's wonderful to be here with you all. So we're going to talk a little bit about how we can turn fear into clarity. It's natural for us to be afraid when we're thinking about the what ifs to type 1 diabetes. So there could be a lot of reluctance to get testing because there's fear of the unknown. And the truth is that anytime we're facing unknowns, uncertainties, they have a tendency to draw us into feeling afraid. So families, individuals who are thinking about testing might think, what is this going to mean for me? How is this going to change my life if I test positive for diabetes? I'm already trying to keep up with everything in my life, and what will this diagnosis mean if it's positive? Life is already full of things that we have to address, things that we have to respond to. And in fact, anything that we have to respond to, whether or not it's a message on your phone or something from work or a health concern, is a stressor. And so when that demand goes up, it can make it more difficult for us to make healthy choices and decisions that can really set us up for longer term success. Because in those moments, we're getting overwhelmed by the uncertainties that a new diagnosis could bring. But screening can really turn that uncertainty into a greater level of understanding. As Dr. Bohari mentioned, that reducing DKA at diagnosis with this screening tool can go from 40% all the way down to 5%. And that's not just a stat. What that number represents, I believe, is our capacity and our ability to know something early. And if we can know something early, what's that going to do? It's going to prevent us from going through crisis, ending up in an emergency room and discovering that we may have this diagnosis, and all the pain and fear that comes with a crisis could be avoided through early detection. So I think it's important for us to work to understand how important knowing early uh, could help us. And then we can ask a different question instead of what if, how's my life going to be different? I can say, what if we test, or what if we don't test? What could happen with that? And, facing the unknown and moving towards that can actually help us develop a greater sense of clarity and confidence in our ability to choose our response. And I don't believe I have the slides, so if somebody could do the next slide for me, thank you. So when we're facing uncertainty, when we're facing anxiety or fear about the unknown, there's some strategies that we can use to bring the temperature down. And the first one here is called grounding. This is a skill that really helps when you're feeling anxious or panicky. And it involves your five senses. So the five is looking around your environment and naming five objects within view. So, for me, it would be my screen, my keyboard, my computer, my cup, my microphone right here around me, four things that I could touch. So you could do this in your own environment. Just notice four things around you, touch them. Notice, are they hard, soft, cool, warm to the touch? Three things that you can hear: the sound of my voice, perhaps sounds coming from outside of your room or even outside of the building or home that you may find yourself in. Two things that you can smell. So that could be gum, an oil, a perfume, something that will just draw you into that scent. And one thing that you can taste. And these are your five senses. And so doing this will often bring the fear or anxiety down because it invites you into the present moment. And this is the only moment we can ever do anything about what's going on in our lives anyway, is in the present. But panic and anxiety is about being transported into the future and thinking about what if this or what if that. And so, what now is what grounding is all about. What am I sensing and feeling right here, right now? And when I do that, then I can begin to see things a little bit more clearly. When we're in fight, flight, or freeze, which is our body's survival mechanism, we have trouble seeing things clearly. We see a distorted view of things. So a skill like grounding can bring the temperature down so that you can see more clearly. You don't have to do all five senses. You may find that just one sense is really helpful for you, like connecting to taste, touch, or smell. Um, and so that one can be helpful. Now, another one I want to share with you all is the mindfulness stop skill. And this is an acronym for how you can practice it. The S is stop, to pause, to interrupt the train of thoughts that may be flowing through your mind at the time. Then take some deep conscious breaths. Breathing in, nice deep breath, nice slow breath out. You can even do this as I'm talking and just kind of notice how you feel when you breathe out slowly. Take a few of those. And this is setting you up to observe what you're feeling and what you're thinking as a witness, as a mindful observer. And so when we're in fight, flight, or freeze, it's like we're falling into a rushing river and we can't get oriented. We can't figure out exactly what's the best thing for us to do. When we stop, when we pause, it's like you get your head out of the water. When you take those deep conscious breaths, you're moving towards the shore. When you get out of the water, you can be more objective about what you're thinking and what you're feeling. And part of this observation is naming and acknowledging your present moment experience. So if your mind is running into the future, you could say, thoughts about the future. Put a label on what is coming up in the moment because this involves the frontal lobe of your brain, which is often disengaged to some extent when you're in a fight, flight, or freeze mode, a survival mode. And engaging this part of the brain helps you feel more calm. Another way to think about this is if you've ever had a question in school and you thought, that's a stupid question. I should know this. I bet everyone else knows it too. And then someone else raises their hand and they ask that question, you feel relief because that person acknowledged something that was going on inside of you, you can give that gift to yourself of acknowledgement, which is observing what's happening, bringing that temperature down. And of course, we can't stay there observing our thoughts and feelings forever. So the next step is to proceed with present moment awareness. How can I bring my full attention into this next moment? And when you do and you practice this, you'll often find a greater level of relaxation and presence and being able to respond to things that you want to be able to respond to with a greater level of wisdom and clarity. So, a mindful reframe. We're shifting from the what if to what now. And if we're not able to ask what now, then we need to go to these first two skills. And there's other skills that you can practice. The mindfulness stop skill is also really like a mini meditation. It's a way for you to be present in the moment and to ground yourself. And then lastly, I just want to mention the power of self-compassion. And this is really like talking to yourself like you're talking to your best friend. So that the next time you mess something up or you don't do something just right, notice how you talk to yourself. What's the immediate voice that comes up? Is it critical? Is it harsh? Is it judgmental? If so, you're not alone. Welcome to the club. You're a human being who has critical thoughts. We all have these kinds of thoughts sometimes. But we can reframe them. We can say, you know what? Let me just imagine that I was going to give this feedback to my good friend. How would I say it to them? And that may help you begin to treat yourself a little bit softer with more compassion. And I just want to be clear here. One of the fears that people have over being compassionate to themselves is they think, well, I'll be lazy if I'm compassionate. I'll let myself off the hook. Compassion is not about being lazy or letting yourself off the hook. It's really about caring deeply enough about yourself that you will do what is actually best for you. And that means taking action to do so. So early testing can be a way of having compassion for yourself, taking that action, because it's really having courage, even though there's fear. Next slide, please. So it's important to know that a part of self-compassion is reminding yourself that you're not alone. So that if you're thinking about testing, you're not the only one who's thinking about it. If you're having fear about it, you're not the only one. And there's resources available. There's counselors available and community resources like Diabetes Sisters to help educate you and support you through this process. Doctors like Dr. Buhari who are willing to walk you through this and help you through this process with the right tests and the right education to empower you. Fear, it's a part of the process. It's a natural occurrence. It means that you love yourself. It means that you care about your resources. And sometimes fear distorted can take our power away. But when we allow the fear to empower us to courage, it doesn't have to lead the way in a negative way. So knowing builds confidence and compassion strengthens your ability to be resilient. So I look forward to, talking to you all more about these skills and about mindfulness and about how you can take care of yourself in this way.
Thank you so much for that, Jude. That was very profound and remarkable recommendations. Thank you so much. For more information about type 1 screening, and of course, this webinar here, we'll have a recording of it. Please go to diabetessisters.org. Remember, action starts with you. There are a lot of resources available on the websites, from webinars to downloadable different topics in which you can gain knowledge from the screening process. You can take some to your primary care or healthcare team when it comes to what screening tests to do, the medication that I spoke about. So a lot of resources here for you at the diabetes.org website.